I'm Dr. Rosenthal. And you? How do I pronounce your name?
Xavier.
Okay. There's a lot of different ways I could.
Yeah.
I'm sure I got it right. You don't need to sit, wait? Okay. Then I'll sit.
Please do.
Because I've always been taught that that's more polite. How are you feeling?
Good.
Sounds like way better than July.
Yeah.
I'm very happy to hear that.
But even in July, he said he's good. So.
Oh, he always says he's good.
Yeah, he's always said he's good.
Well, you know, that's a good attitude to have.
Yeah.
It'll carry you a long ways.
He has a very high tolerance for pain. So.
Any problems, concerns, or topics you want to talk about today?
No.
No.
Oh, I guess. Are we still gonna have like where we need the I guess the phone to get the.
Oh, if you're gonna have any surgeries in Tipton, I don't. Let's find out.
I know like you the doctor probably might give you a phone or the.
I mean,
number
that's if you're
for
gonna
it.
do a transplant. Then there's a certain phone call you get, but I don't think we're there yet. No hard. Maybe not.
We are not there yet.
Good.
And how about you? Anything that you wanted to talk about for sure?
No, I there was that concern about the PLE, but I think Dr. Evil said maybe no. So all his tests came back good. So
That's good.
we're
Then let me ask you to lie down. I'll listen to you, and then I will just start talking and lead you to a few questions. We'll see. Your feet some nice support there.
and leave them uncrossed, please.
Where do you live?
Dinuba. So it's like Tulare County, right by Fresno.
Yep.
So we're like 45 minutes away from Children's Hospital in Fresno. Okay.
And that's where you get most of your care, right?
Yeah.
And we can arrange for you to see either me or Dr. Dykes, but as part of the heart failure program down there as well.
Okay.
We don't have
And
a
he's very
ton-
ticklish, so
Oh, I'm sorry.
just trying not to laugh.
We don't have a ton of appointments down there, but there are enough that
Okay.
get in. Some people prefer to come up here, and that's fine too. I think it depends on your tolerance for driving.
Yeah. Well, right now he's not in school.
Okay.
He's on like a hospital care, so
Alrighty.
he's like, bring it on.
Putting your arms down on your side. I'll listen to you. Is he going back to school this year? Or?
It all depends on what everybody says. If they give him the okay to, because he couldn't go because he had the NG tube, and he just really got that out like a week ago. So it's like after everybody.
Were you able to hear his TR?
Slightly.
What's that? And let me see your neck. Just stretch it out for me.
You can see leaned up,
You
but
can put your head back down. That's perfect. But sort of lift your chin up a little bit. Okay. Listen to your back. If you don't mind just opening your mouth and breathing in and out slowly. Thank you. Okay, thanks. And I'm going to ask you to stand up for me. Just stand up as straight as you can. Okay. And now bend over to touch your toes. Okay. You're great. Sit wherever you're comfy. So, let's tackle the small and easy stuff first.
okay.
I don't think that Xavier had protein-losing enteropathy,
Okay.
PLE, when you look at all the tests as they've come back. I think there was a suspicion of it
Mm-hmm.
early on before all the test results. And I think we can just sort of put
Okay.
that one aside. It didn't happen to him. And it sounds like most of the symptoms that he was having really were related to the gallbladder and the esophagus, the
Yeah.
throat, and not to his heart. Which isn't to say that all is well with the heart, because he does have a Fontan. We need to pay attention to it. But I don't think that there's necessarily any big difference in his heart function and heart status today versus 6 months versus 12 months versus 18 months ago. I think he's been actually pretty stable with that.
Okay.
The thing is, anytime someone with a Fontan has a symptom, we all assume it's the Fontan at first. And
They
some-
didn't.
They didn't?
Yeah,
Oh, well.
cardiology wasn't aware for 2 weeks.
Ah,
Yeah. They were
Well,
like, oh,
there's
we're
def-
gonna send him out to Stanford, and I was like, well, have you guys talked to cardiology? No. But, well, why? Like,
Well,
shouldn't
definitely.
they have known, at
Okay.
12:01 when we showed up?
Yeah. We'll come back to that one for sure.
Yeah.
And when I go through Xavier's sort of descriptions of things that Julie obtained, as well as his labs and his echo and things like that, I would say he's got a little bit of leakage of the
Mhm.
tricuspid valve. He's got
Which
that-
he's had for a
Yeah,
while.
exactly. He's got the aneurysm that you know about.
They actually, from his, December, when he did his cardiac cath, she said it's not it was just like leftover material.
Oh, even better.
Yeah, that
that-
there's 2 of them, and she's like, it's like little, like stitch that was never dissolved. And I was like, oh, well, that's weird, but okay. She's like, yeah, it's not an
We
aneurysm.
weren't able to look at the cath pictures today, but I'll get a hold of them and I want to see that myself.
Yeah, she's like, I was looking at it for like 6 months, and I finally figured it out. I was like, oh, you're weird, but okay. You figured it. She was like, I wanted to know what it was.
Who was it
Is
who
it-
figured it out?
I don't. One of the cardiologists here that did his cath, and I was like, okay,
Oh, the
cool.
one in December here.
Yeah, that she had went all the way back to all of them. She's like, and it's still there. It's never grew, so it can't be an aneurysm. And she's like, it took me a while, but I figured it out. Because she called and was like, oh, weird.
You want that kind of weird on your team?
Yeah, I'm like, okay.
Good. As long as that's not growing, then we don't need to worry too much about that either, because it certainly isn't big enough to matter now.
Yeah.
So, he's on enalapril, he's on Lasix, he's on tadalafil, he's on spironolactone. All of those things are doing what we can to protect his heart. And I
Okay.
would say there are 1 or 2 other medications that conceivably could be used, but I don't think he has an indication for them right now.
Okay.
Only thing I would say is when I looked at his cath data, the pressures in the Fontan were a little higher than we might like them to be, and his Lasix dose is a little on the low side, so I think we can make an adjustment there
Okay.
to help bring those pressures down a little bit. I don't think he'll feel any different, but if we look at what's going on inside his body, maybe it'll make a slight tip towards things working better.
Okay, sounds good.
Worth a shot anyway. And other than that, I think he should have sort of normal Fontan follow-up care.
Okay.
I do think, given all the medications that he's on for his heart, that having him see our team from time to time is probably worthwhile. And by from time to time, I'd sort of say maybe once a year for now.
Okay.
I don't know if you also want to see the single ventricle program. Are they providing services that are?
Yeah, they
useful?
were, so they're like, okay,
Coordinating.
he'll see them if you guys don't need to see them. I'm like, okay. Because like right now they don't know what's going on.
So why don't we say that we'll see him in the PACT program, which is the Fontan and other heart failure program,
Okay.
in 12 months.
All right.
And see Dr. Simbre in 4 months,
Okay.
and the single ventricle program in 8 months. So sort of 3 visits in a rotating scheme.
Okay. Sounds good.
I think that's about the right number of people keeping an eye on.
Yeah.
And then the other thing I was going to say, and you've highlighted how important that is. I mean, if there's a change in how he's feeling, then I would say
Cardiologist.
escalate that to Dr. Simbre.
Yeah.
If he gets hospitalized, I would say you should place 2 phone calls.
Yeah, obviously. I
one of them-
thought
one of them-
cardiology was aware, but
I think that was a very reasonable assumption, for sure.
because they always are aware.
And for some reason, we now know differently.
Yeah.
So not only Dr. Simbre, for sure, but also just let us know.
Okay.
Because we might change our follow-up schedule if we know that he's been hospitalized for something.
All right.
Even though we probably won't do anything that'll change what's going on in the hospital. I think that's for Dr. Simbre down there. But
Okay.
we might decide we want to see him a little sooner. Sound okay to you?
Yep.
Mhm.
I think your heart's doing what it's supposed to do.
Sounds good.
And hopefully, no transplant in the near future. Possibly someday.
Okay.
I mean, you know that already on this
Yeah.
here. You wouldn't have brought the word up.
Yeah.
And Beryl will talk
I've
to you
known
about
for years, so.
Yeah. But having said that, of the people we see here who are sort of thought to maybe need transplant, Xavier doesn't seem to me to be particularly close to that point.
Okay.
Um,
Yeah, Dr. Simbry said he was, when I was pregnant, he was the worst case he's ever seen. And then now he's like the best case he's had. He's like, I don't know what happened, but he flipped it. I was like, oh, yep,
Something got better.
yep, sounds about right.
I think take the win.
Yeah,
That's all I got.
yeah, because he told me to plan his funeral.
Ooh,
Yeah, I was like,
those
oh,
are pretty grim words.
yeah, especially being 6 months pregnant. Like, nope, I'm not gonna do that. I'll just plan to give him a name that means he's gonna get a new home. Because I had said that I was gonna donate his organs. And I don't know, but now he's
You better
here.
keep those organs.
Yeah, looks like that
You
is.
look like you need them.
He's good now.
Well, that's quite a story.
Yeah.
Have
And
you
then
ever heard
Dr.
that story
McDonald being
before?
like, I don't know, but he made it.
Had you ever heard that story before?
Like when
Kind
we
of,
come
when-
when we come back from
The hospital last time I had
Hospital.
finally told him. And Dr. McDonald that did his surgery was like, I don't know how he survived, but he survived.
Wow.
And then going into his fontan, hopefully he doesn't do like what he did last time. What did he do? He didn't want to start his heart. I was like, oh, thanks. So you're gonna go in for surgery in like 2 weeks and you're telling me his heart wouldn't start? That's reassuring. He's like, he likes to just kidding. Starts up on his own.
Well, this is a related topic then.
Mm.
It doesn't sound as if he needs to have anything done for his throat other than what's already been done.
Okay.
But if there's a conversation about surgery at some point in the future because things get worse there, I'd very much like our group to be involved in that discussion.
Okay.
And Dr. Simbray 100% has to be involved in that discussion. Risks of anesthesia and risks and benefits of different kinds of approaches. I think it's worth thinking about him as a future transplant candidate in planning out the best surgical approach.
Okay.
And usually there's a choice of different approaches.
Mm.
Now, at this point, not needed, but just sort of to put that in the back of your mind.
Okay.
That's all I have.
All right. He's just like, can we go eat?
It's okay with me. Thanks for coming up here today.
Yep.
Very
I'll
nice to
invite him
meet
to
you.
come. Thank you.
Thank
All right. Ready?
Yeah.
All right. I'll finish up.